Welcome to the Cost Savings Programs edition of Medicare in Minutes, a micro-learning series designed to help you understand the ins and outs of Medicare. Beneficiaries with lower incomes may qualify for help from their state through a Medicare savings program. Some programs could pay a beneficiary's premium, while others could help with deductibles, coinsurance, and copayments. Each program is different and assistance will vary from state to state. Let's take a closer look. 4 programs are available to beneficiaries with Medicare, plus an additional partner program called Extra Help, which we will talk about in another video. Each state establishes their own specific qualifications to determine eligibility. So while beneficiaries might not meet the qualifications specifically mentioned in this video, they might meet the requirements in their local area. Contact your local Health and Human Services offices for your state's specific requirements. Beneficiaries can only receive assistance from the program they qualify for. Before we dive into each program, let's take a quick look at the eligibility factors for these programs. Eligibility for each program is based on 2 factors, a monthly income limit and a resource limit. The monthly income limit is fairly self-explanatory. Beneficiaries who earn income above the limit for a given program are not eligible for that program. Resources, on the other hand, include a variety of monetary tools, including money held in checking, savings or retirement accounts, stocks, and bonds. States are prohibited from counting the following assets toward the resource limit: the home, 1 car, a burial plot, up to $1,500 for burial expenses if it is set aside, furniture, other household and personal items. Now that we better understand the eligibility criteria, let's dig into each program. We will first talk about plans that provide support for those who are eligible for both Medicare and Medicaid, then work our way into programs for those who are not. The Qualified Medicare Beneficiary Program, or QMB program, pays the full cost of Part A and B premiums, Part B deductibles, coinsurance, and Medicare-covered copays. Beneficiaries might be responsible for small Medicaid copays, but will not be billed for Medicare-covered services. To qualify for QMB, beneficiary income cannot exceed the income and resource limit. Some groups, such as those who already qualify for Medicaid, might automatically qualify for QMB. Those who qualify for QMB are forbidden by federal law to receive bills from any Medicare providers or pharmacies. However, there may be circumstances where beneficiaries might get a bill mistakenly. In that case, beneficiaries should contact Medicare to fix any issues. To apply, beneficiaries should check local qualifications, ensure they meet income qualifications and resource limits, sign up for Medicare Parts A and B, then apply by calling your state Medicare program. Approval can take up to 45 days and benefits begin the month following approval. Enrollment must be renewed yearly and cannot be applied retroactively. But like we stated earlier, it might be worth trying to apply even if you are not sure you will qualify, since each state works differently. Next, we have the Specified Low-Income Medicare Beneficiary Program. This program's supports are limited to full payment of Part B premiums. The program does not assist with any other cost sharing. Unlike QMB, SLIM does apply retroactive payment for up to 3 months. Once beneficiaries qualify for this benefit, they will no longer be expected to pay their Part B premium and will receive a deposit for the 3 months previous. To apply, beneficiaries should contact their state health insurance assistance program and fill out an application. We also have the Qualifying Individual, or QI program, designed to provide help with Part B premiums. Again, beneficiaries must have both Parts A and B to qualify. Beneficiaries must apply for this program each year and are also eligible for Extra Help. This program differs from others in that it is not designed for beneficiaries who are also eligible for Medicaid. However, those beneficiaries would likely find themselves suited for either the QMB or the SLIM programs. Lastly, individuals who have a disability, have returned to work, and have lost their Social Security disability benefits and premium-free Part A benefits as a result may be eligible for a separate program, the QDWI, or Qualified Disabled Working Individual Program. Unlike other programs discussed so far, this program only provides assistance with the Part A premium. It helps to offset the costs incurred because the beneficiaries lost their premium-free eligibility. You might wonder why the monthly income limit is so much higher than for other programs. This is chiefly because the Part A premium far exceeds the Part B premium. Because of this, paying the full Part A premium is a greater burden on beneficiaries. Individuals who are eligible for this program are not automatically qualified for extra help. Extra help can be triggered when the beneficiary receives assistance with their Part B premium. However, it may be worthwhile for the beneficiary to apply for extra help on their own should their income and resource limits qualify them. Between these 4 programs, there are options for those who struggle to afford health insurance in their senior years. It is important to strike a balance between affordable and appropriate coverage, and these programs can be of assistance in that venture. Most of these programs also pair with Extra Help, a program for Part D drug benefit support. More information on that can be found in another video. While shopping for Medicare can be a nerve-wracking experience, you can take steps to prevent some stress associated with affordability when working with a knowledgeable agent. Questions regarding this and all other Medicare topics can be directed to your agent. Thank you for watching.